hand hygiene. Hi, my name is Abby. I'm a student nurse with HACC. How are you today? I'm doing good. How are you? Okay, great. Can I please have your name and date of birth? Suzuki Osaka 1150. Okay, great. So today I'm going to be hanging an IV bag and changing your tubing and your solution out. Okay, great. I'm going to go ahead and pull the curtain and give you some privacy. So the first thing that I would do is I would don gloves and I would inspect the IV site. So I would inspect to see if there was any redness, if they had any pain upon palpation, if there was any leakage, either from the IV itself or from like a hub if it wasn't closed properly. And then I would check for inflammation and swelling as well. So if I palpated over the site, if they told me that they had pain and it felt warm to the touch, that would indicate that the patient more than likely had phlebitis. Or if I palpated over the site and it was swollen and it felt cool to the touch, and they didn't really have much pain associated with it, it would be more indicative of infiltration. So the solution that we had been giving the patient was leaking out of the vein itself, and had gone into the underlying tissue. So my patient's IV, it does not present with phlebitis or infiltration of any type. So I'm going to go ahead and I'm going to start to prep my tubing and my IV solution. So I'm going to take off my gloves. Obviously, this is not the proper way to take off gloves, but I need them for when I have to re-don them later in the video. So in reality, I would have taken them off and put them in the trash can. So I would need to gather my supplies. So I would need my IV tubing, which I would take out of the packaging and keep sterile and clean before I open anything else. So I would obviously perform hand hygiene again. Then I would take my IV solution and I would check the expiration on my IV solution. I would check to make sure that the bag itself did not have any breaks or tears or that it was leaking solution anywhere. And I would check to see how much solution was in the bag. So if it was a 250 bag and there was not 250 milliliters of solution in the bag, I have to get a new bag, and I'd make sure that the fluid was clear and it was not cloudy in any way. So my solution checks out. It is not expired. It is okay to administer to the patient. I'm gonna put that back in my cup so it doesn't fall over and make a mess. So then I would check my tubing. I would make sure that all of my caps were in place on my tubing, that there was no physical defects with my tubing. And then I would make sure that my clamp was closed. So roll my clamp down and make sure that is closed for when I spike my bag. So I would, if I just got it out of the packaging, there'd be white tape around it. I would take that off, and then it wouldn't be tangled and just like this. It'd be nice and neatly coiled. So the next thing that I'm going to do is making sure that I maintain sterility is I'm going to take my IV solution. I'm going to hold that in one hand and with my spike in the other. I'm going to remove the blue cap from my IV bag. And it just squirted everywhere. It wouldn't do that in real life, but because I already have the bag spiked, it kind of squirted everywhere. So I would take this and I would discard of that, and then I would take my spike, maintaining sterility. I would take the cap off of my spike, and treating my spike like a sharp, I would be mindful of my hand placement, and then making sure that I didn't like miss and like rub the spike all over the outside of the tubing. I'd want to make sure that I got it in the side of the tubing, and then insert and twist my spike into my bag. And then I would go ahead and I would hang this on my IV pole. So bring this down a little bit just so you can. So I would hang it on the IV pole, like so, and then I would squeeze my drip chamber here until it was half full of my IV solution. So half full. I'm actually going to raise it back up a little bit so I have gravity on my side. So then after I made sure that my drip chamber was half full, I would go ahead and I would slowly start to open my clamp. I'm going to have to open it a little faster than I normally would to get it to go. Okay. So it came out a little bit faster than I expected it to. So I'm going to go ahead and back up again. So as my solution flowed out of my tubing, down my tubing, I would invert at all of my Y sites. And tap to make sure that there were no air bubbles, and then following the solution down the tubing. Invert again once it gets to the Y site. And then invert once again at this Y site, flick to make sure that there was all the air bubbles were out of it, and then I would go ahead and close my drainage again, and then I would go back and inspect my tubing and make sure that there were no large air bubbles in my tubing anywhere. So there are some here that if this was to be administered to a patient, I'd have to let those bubbles run out. Like there are some more. But I know that if this was in a clinical setting, I would have to continue to run my tubing in order to get those air bubbles out of my line. And this end is in the cup because it was dripping. And this is the end that would be connected to the hub on the patient. So I have that. So now that I have my my tubing primed, I'm going to don gloves again, this time to actually access my IV site. So I would take my saline flush, I would take the cap off, and I wouldn't hold it like I just had down here. I would maintain sterility of my syringe, and I would prime by pulling back a little bit to break the seal, and then push up until I got a bead of my flush at the end of my, and making sure that my cap remains sterile as well. So now that that is flushed, or my flush is ready to administer, then I would come to the end of my IV site and I would scrub this with alcohol for 15 seconds. Scrub. So I had that scrubbed for 15 seconds. So the next thing that I am going to do is I am going to take my flush, holding the end of my hub here, the end of my extension. I'm going to take it, I'm going to uncap my flush, and I'm going to hold and inject my flush onto the end of my extension. And I'm going to go ahead and I'm going to administer my flush, so 3 to 5 mLs saline into the flush, or into the IV, I mean. So I've gone ahead and I flushed my IV. So then, keeping this sterile and clean and up, I'm going to go ahead and I'm going to take my IV tubing, and then I'm going to go ahead and remove that cap as well, making sure that I'm not touching this as I'm removing this cap, and this cap isn't touching anything else, or the end of my IV tubing isn't touching my hands or the patient or anything like that. And then I'm going to hold the little clamp that would go over, that would lock onto this. I'm going to hold that back, and I'm going to go ahead and I'm going to insert that into the end of my IV hub extension. And I'm going to slide the little lock down and lock that onto the end of my tubing. And then I would go ahead and I would open my clamp here, and then I would adjust my drip rate according to the doctor's orders. So it's not dripping, but I would adjust it, or I would have set my my pump with my infusion rate, and then I would make sure that the bed was low and that my patient had their call bell, and that after I pushed the flush and the IV was running, that there were no apparent issues with my IV as it was running, that it was okay before I administered the flush, and then I got like infiltration, or like this port here was leaking all over my patient. So